Noonan syndrome is a rare genetic disorder that affects multiple parts of the body and is characterized by distinctive facial features, heart defects, developmental delays, and various other physical abnormalities. It belongs to a group of conditions known as RASopathies, which are caused by mutations in genes involved in the RASMAPK signaling pathway, a pathway crucial for normal cell growth and development. This condition can affect both males and females and is estimated to occur in approximately 1 in every 1,000 to 2,500 live births worldwide. Genetic causes and inheritance. Noonan syndrome is primarily a genetic condition caused by mutations in specific genes, most commonly the PTPN11 gene, which accounts for about half of all cases. Other genes involved include SOS1, RAF1, CRAS, NRAS, RIT1, BRAF, and several others. These genes regulate the RASMAPK pathway, which transmits signals within cells that control growth and development. Mutations in these genes disrupt the pathway, leading to abnormal cell function and the clinical symptoms associated with the syndrome. The disorder follows an autosomal dominant inheritance pattern, meaning only one copy of the mutated gene is enough to cause the condition. In some cases, an affected person inherits the mutation from a parent who also has Noonan syndrome, while in others, the mutation arises spontaneously, de novo, with no family history. Physical features. One of the most recognizable aspects of Noonan syndrome is its characteristic facial appearance, especially noticeable in childhood. Typical features include a broad forehead, wide-set eyes, hypertelorism, droopy eyelids, ptosis, and low-set, backward-rotated ears. The face may appear triangular, with a small chin and a short neck that may have extra skin folds, often referred to as a webbed neck. As the child grows, these facial features may become more subtle, making the condition less noticeable in adults. Cardiac abnormalities. Heart problems are among the most common and serious manifestations of Noonan syndrome. Approximately 50 to 80% of individuals with the condition have some type of congenital heart defect. The most frequent is pulmonary valve stenosis, a narrowing of the valve that controls blood flow from the heart to the lungs. Another major heart issue is hypertrophic cardiomyopathy, HCM, where the heart muscle becomes abnormally thick, making it harder for the heart to pump blood. Other cardiac defects may include atrial septal defect, ASD, ventricular septal defect, VSD, or coarctation of the aorta. These problems often require careful monitoring and sometimes surgical correction. Growth and development. Children with Noonan syndrome often experience growth delays. At birth, their length and weight are usually within normal range, but growth slows during childhood, often leading to short stature in adulthood. Some individuals may receive growth hormone therapy to help improve height. Delayed puberty is also common, and in some cases, fertility may be affected, particularly in males. Developmental milestones may be slightly delayed, and mild learning disabilities or difficulties with speech and motor coordination can occur. However, intelligence is typically within the normal range, and many affected individuals lead independent lives with proper educational and medical support. Other health issues. Several other systems in the body can be affected. Many individuals have bleeding disorders due to clotting factor deficiencies or platelet dysfunction, leading to easy bruising or prolonged bleeding after injury or surgery. Eye problems such as strabismus, crossed eyes, or refractive errors are common, as are hearing issues due to chronic ear infections. Additionally, some people with Noonan syndrome may experience skeletal abnormalities such as a broad chest with wide-spaced nipples, a curved spine, scoliosis, or joint laxity. Males may have undescended testicles, cryptorchidism, which can affect fertility later in life. Diagnosis. Diagnosis is typically made based on clinical features, family history, and genetic testing. Doctors look for characteristic physical signs, heart defects, growth patterns, and other related symptoms. Molecular testing can identify mutations in one of the known associated genes, confirming the diagnosis. Early diagnosis is important for managing potential complications, particularly heart defects and developmental issues. Treatment and management. There is no cure for Noonan syndrome, but treatment focuses on managing symptoms and preventing complications. Regular monitoring of the heart by a cardiologist is essential. Growth problems can be addressed with growth hormone therapy if appropriate. Developmental delays benefit from early intervention programs, including physical, speech, and occupational therapy. Surgical treatment may be necessary for some cases of heart defects, undescended testicles, or significant skeletal abnormalities. Regular hearing and vision screenings are important, as are blood tests to monitor bleeding disorders. With appropriate medical care, individuals with Noonan syndrome can live relatively normal and fulfilling lives. Prognosis. The prognosis varies depending on the severity of heart and other medical problems. Many people with Noonan syndrome have a normal life expectancy, particularly those without severe cardiac involvement. Advances in medical management have significantly improved outcomes over recent decades. Conclusion. Noonan syndrome is a complex yet manageable genetic condition that affects multiple body systems. Through early diagnosis, comprehensive medical care, and supportive therapies, individuals with this disorder can overcome many of the challenges it presents. Awareness and genetic counseling remain crucial for affected families, ensuring better understanding, care, and quality of life for those living with the syndrome.